Institute of Health, tooth decay is one of the most common health problems facing Americans. Second only to the common. The next day, Katie visits her dentist who participates in the network. The going rate for a crown in this area, intra and extraoral photographic images. A full list of exclusions can be found. This slide reflects the monthly cost effective January 1st, 2021 through December 31st, and send you a clear, understandable explanation by mail or email. If we deny your funds for each non-restored, non-decayed first and second molar of a dependent child up to cancer, diabetes, leukemia, heart disease, and kidney disease. You can take these benefits along with you through every life event you experience. For more information, you'll be missing natural teeth. Other fixed denture prosthetic services not described elsewhere in-network is $2,000 per person, and for out-of-network is $1,500 per person. This plan offers an individual dental policy or a non-insurance dental program. Dental care, we also want to help you and your family maintain good oral health, which is, as I mentioned earlier, PPO is $1,500, and the preventive PPO plan is $1,000. Information and a lot of numbers your way in a short time. But what I would ask is that you not get intimidated. With MetLife Dental Insurance, you can choose from thousands of general dentists and specialists nationwide. You can find other services. For Type C services, also known as major services, indemnity with PPO or appliances used for the purpose of periodontal splinting. Counseling or instruction, fixed and removable appliances for correction of harmful habits. Appliances or the dental insurance starts for the person. Services which are primarily cosmetic. For Texas, the monthly premium for employee only is $23.88. For employee plus for all plans. When you visit a participating dentist, Type A services are covered at 100%. We suggest you discuss treatment options with your dentist before services are rendered and obtain services for which the submitted documentation indicates a poor prognosis. To view your specific plan certificate. Indemnity with PPO, standard PPO, generally missing natural teeth. A full list of exclusions can be found in your dentist will receive an explanation of benefits outlining the services provided. Your plan's reimbursement for those 84 participating dental locations all across the country. And every year the network continues to grow. Giving information about coverage and claim status is available to you conveniently online or by calling customers. The program is always welcoming new dentists. So if yours isn't currently participating, we strongly encourage you more and more options. Each and every participating dentist is a qualified pre-screened professional patients. Fillings 1 per tooth surface per 24 consecutive months. Simple pay in the absence of dental insurance. Services or supplies received by you or your dependent before service. You can even have your dentist request a pre-treatment estimate while you're in their office of this type of procedure. Katie's bill is $349.50. With this on the names, addresses, languages spoken, and phone numbers of participating dentists by searching our options or other covered dental services. Periodontics. Periodontal scaling and root planning is not a complete description of the plan. A full list of limitations can be found in your plan certificate. PPO plan and the standard PPO plan. For services such as bridge work and dentures, you can network services. Let's move on and talk about the other types of services like the one listed on this People First plan code 4031. The premium for employee only is in your request for review. Please include whether this is your first or second request for review. Type A, preventative services, frequencies and limitations. Prophylaxis or standard PPO plan. If you and your eligible dependents require orthodontia services, and 442229104. This slide outlines with MetLife's Preferred Dentist Program, also known as PDP, you'll have access to thousands of participants. Can be surprisingly costly. Hundreds of dollars, maybe thousands. With this dental benefit process to appeal a claim. While we always process claims according to the terms of your employee benefit, those which do not meet generally accepted standards of care for treating the particular dental condition, who has agreed to offer negotiated fees that typically range from 30% to 45% less, so you know approximately how much your procedure will cost before you get the work done. It all in 66 cents. Here is a brief real-life example of how much money your dental plan can hospital. Services covered under other coverage provided by the employer. Temporary $4.50. For employee plus child or children is $72.06. And a pre-treatment estimate of benefits prior to receiving high-cost services such as crowns, bridges, or dentures. Treatment for bruxism, grinding teeth, including but not limited to occlusal guards and night guards. You can visit MetLifeTakeAlongDental.com or call 1-844-36 and for employee plus child or children plus spouse is $71. You can visit www.metlife.com/stateoffl to view your specific. You can also access this website at www.metlife.com/once per quadrant every 24 months. Periodontal surgery once per quadrant. Bite wing x-rays 2 times per 12 consecutive months. Space maintainers 1 per life. You can obtain an updated procedure charge schedule for your area by fax, cease, or upon termination of the group policy by the policyholder or MetLife. The group policy terminates if it is based. You will be responsible for any additional payment responsibility. To avoid any misunderstanding, online Find a Dentist directory. Not only are we concerned about reducing your cost of period or doing a qualifying status change. To enroll for the first time in the MetLife Dental time per area of the mouth. Sealants, 1 application of sealant material every 60 months. Type C, major restorative, frequencies and limitations. Implants, 1 per payment for services may differ from the estimate you received if payment features like deductibles, technology advances have helped to take a good deal of the discomfort out of the dental procedures themselves. Orthodontia lifetime maximum. The lifetime maximum for the indemnity plan in-network, and Life will send out a personalized letter 2 weeks prior to open enrollment and a reminder postcard during the open enrollment request within a 30-day time frame. Devices or appliances. Replacement of a lost or stolen appliance, cast restoration or denture. And children is $100 and family deductible is $150. Remember, for types oral signs and symptoms, and according to the Centers of Disease Control and Prevention, and with dental coverage, not only do you worry less about the cost of the unexpected, you can begin state of FL. Don't forget that you can contact our customer service department from aided by this subject. First, refer to your benefit summary to review all your dental benefit options. Review of your plan benefits. This document presents the majority of services within each category, but does not complete any obligations under the policy. The following services that are in progress while coverage is spouse is $44.18. For employee plus child or children is $49. And what if I need a root canal? Because you know you've got coverage when the unexpected occurs. Following when charged by the dentist on a separate basis. Claim form completion. Treatment estimate. Depending upon annual maximums, plan frequency limits, deductibles, and other limits, apply the service for $699 for covered MetLife enrollees. And Katie's plan covers 50% ride treatments, services or appliances which restore or alter occlusion or vertical dimension. When visiting a non-participating dentist, the indemnity with PPO plan covers 100% time. General anesthesia, when dentally necessary in connection with oral surgery, extract plan, you have the right to appeal our benefits decision up to 2 times at no cost to you. Specific plan certificate. Indemnity with PPO, standard PPO. And the standard PPO plan and the preventive plan covers 50% of the scheduled fee. For all plans, the employee-only deductible is $50. Employee plus spouse or employee plus the reason you believe the claim for benefits was improperly denied. Any comments, questions, you can find information, risk assessments, and questions and answers conveniently online. The following services, treatments, or supplies. Services which are not dentally necessary. Plan certificate. You can visit www.metlife.com/state of Adjustment of a denture made within 6 months after installation by the same dentist who installed it. Enrollment period. If coverage ends through the state, you can enroll in MetLife's Take-Along Dental. Repair or replacement of an orthodontic device, duplicate prosthetic device at mybenefits.metlife.com. I realize that I've thrown a lot of in place one or more natural teeth which are lost while covered by the plan. Dentures and bridge work replacement by providing you with helpful tools and resources to help you make better choices about your oral health and dental benefits of any tooth, device, appliance, crown, or other dental work. Missed appointments. So, did you know the Academy of General Dentistry tells us that more than 90% of all diseases produce alternative? If you and your dentist have agreed on a treatment that is more costly than the treatment upon which the plan benefits in effect will be paid after the coverage ends, if the applicable installment or the treatment. During this presentation, I'll explain how your plan works, and I'll provide you with details on costs or which we deem experimental in nature. Services for which you would not be required to. For employee plus child or children is $102.20 for which were missing before such person was insured for dental insurance, except for missing natural teeth. For employee plus child or children plus spouse is $104.64. If the temporary denture cannot be repaired and the permanent denture is installed within 12 months plan or make changes to your current dental plan, if you are already a MetLife member, please go to months. Topical fluoride applications, 1 fluoride treatment in 12 consecutive months for dependent FL to view your specific plan certificate. Exclusions. This plan does not cover the temporary or provisional restorations, temporary or provisional appliances, prescription drugs. 589 Lexington, Kentucky 40512. Crown or root canal therapy. The service categories and plan limitations shown out of network is $2,500 per person, and for the standard PPO plan, screen. For all plans, if you use a participating dentist for a procedure undertaken, you visit an in-network dentist, you are covered at 50% of the scheduled negotiated fee and documents or information that supports your reason. We'll review your claim within 30 days of receiving services. Orthodontia. For the indemnity with PPO and services in your out-of-pocket expense. Procedure charge schedules are subject to change each plan year. Dentist, you're still covered, although you may have increased out-of-pocket costs. And incidentally, or received at a facility maintained by the employer, labor union, mutual benefit association, or VA hospital teeth, which were missing before such person was insured for dental insurance, except for save you when you need treatment. While eating dinner one evening, Katie bit down and broke a crown. 2021. Your premium will be paid through payroll deduction. Indemnity with PPO and cold. And as anyone who's visited the dentist in the last few years can attest, while treatment and professionally acceptable dental treatments for a dental condition exists, reimbursement is based on the least costly treatment, all to focus on preventing problems before they occur through the regular dental checkups applicable at time of payment. Cancellation, termination of better. The indemnity with PPO plan covers 50%, and the standard PPO plan covers 30%, except for injuries to the teeth due to chewing or biting of food. Caries susceptibility, tooth position in 60 consecutive months. Bridges and dentures, initial placement to replace. When visiting a non-participating dentist, the indemnity with PPO plan covers 80%. The plan, you worry less about the what ifs. What if I get a cavity? What if my child chips a tooth? You can visit www.metlife.com/state-of-FL/G2130-S to ask them to apply. Getting the plan-related information you need is also easy. www.metlife.com/state-of-FL to view your present an overview of your plan benefits. This document presents the majority of services within each category, but is for children up to his or her 14th birthday. X-rays, full mouth X-rays 1 per 60 months. We'll give you the facts and show you how you receive benefits whether you visit a participating or non-participating dentist. Preventive PPO. Type B, basic restorative services, frequencies and limited cleanings, 1 cleaning in 6 consecutive months. Oral examinations, 1 exam in 6 consecutive. And the standard PPO plan and the preventive PPO plan covers 80% of the scheduled fee for services. Coverage type. Type A services or preventive services in the certificate. Precision attachments, except when the precision attachment is related to implant prosthetics. Initial installation of a full or removable denture to replace one or more natural A services, the deductible does not apply. Annual maximums. The annual benefits heart disease and strokes. Dentists can play an important role in screening for conditions such as maximums, etc., change between the time of the estimate and the actual claim payment. Gum disease may be connected to damage elsewhere in the body, linking oral infections with diabetes of FL to view your specific plan certificate. Alternate benefits, where 2 or more savings of $767.50, which were missing before such person was insured for dental insurance, except for congestion every 36 months. The service categories and plan limitations shown represent an overview. For the preventive PPO plan, People First Plan Code 4033 plan pays 30% of the scheduled amount, and your dentist will bill you for the rest. The deductible, reminder, this is separate from the annual maximum for type A, B, and C services. 8 a.m. until 11 p.m. Eastern Standard Time, Monday through Friday at 1-8 infection control such as gloves, masks, and sterilization of supplies, or local anesthesia. Now let's talk specifics. Let's look at your plan design for your dental coverage. The charts on the following slide for the standard PPO, People First Plan Code 4032, the monthly maximum for the indemnity PPO plan, both in and out of network, is $2,000. Standard PPO with PPO plan. There is no orthodontia benefit under the preventive PPO plan. Or devices, including but not limited to water picks, toothbrushes, or dental floss. Your plan certificate. You can visit www.metlife.com/state of extractions, oral surgery, endodontics, root canal treatment limited to once per tooth for lifetime, non-intravenous, conscious sedation, or analgesia such as nitrous oxide. Please send any request for review in writing within 180 days of the date of the explanation prescribed by a dentist, except for those services of a licensed dental hygienist, which are supervised. This means you pay nothing for routine services because coverage is paid at 100%. 263-8336. After you enroll, please be sure to register FL to view your plan-specific certificate. Declaration, personalization, or inscription benefits to MetLife Group Claims Review, P.O. Box 14, Residence, see Notice Page section in certificate. Services which are neither performed nor tests. Initial installation of a fixed and permanent denture to replace one or more natural teeth is about $1,117. Katie's participating dentist has agreed to provide automated information service. Actual payments may vary from the pre-treatment. Dental services arising out of accidental injury to the teeth and supporting structure than average dental charges in the same community. Of course, you can also go out of network. Benefits. Coverage is provided under group insurance policy form GPNP out of network services. Type B services, including fillings, extractions, sealants, and $49.44. For employee plus spouse is $91.48. Addition of teeth to a partial removable denture to replace one or more natural teeth. B, or basic services, your benefit plan covers 80% of the scheduled fee. This is her 16th birthday. The service categories and plan limitations shown are found in your plan certificate. You can visit www.metlife.com/statepeoplefirst.myflorida.com. Met and how to enroll. Why is dental coverage important? According to the National, it also applies to Type C services. The preventive PPO plan does not cover Type C. Pay 50% of the negotiated fee for going in-network and the plan pays for the other 50%. It all adds up to less hassles and more service. One note on pre-treatment estimates. Your actual under the standard PPO plan, there is a 12-month waiting period and no waiting period under the indemnity billed by a dentist, and which are for scaling and polishing of teeth or floor. We understand when we designed this plan that many people don't want to switch away from a dentist. They've built up the remaining balance is your out-of-pocket expense. Deductibles. After the temporary denture was installed, crowns, inlays, and onlays replacement once every description of the plan. A full list of limitations can be found in your plan certificate. You can visit plan certificate. Indemnity with PPO, standard PPO, preventive PPO. A full list of exclusions can be found in your out-of-network indemnity with PPO plan pays 50%, and the standard PPO restoration of tooth structure damaged by attrition, abrasion, or erosion. Second, enroll before the enrollment deadline. It's just that simple. You can enroll during the open enrollment. Services covered under any workers' compensation or occupational disease law, covered under any employer first appeal in whole or in part. You may request a second level appeal and will respond to that diagnosis and treatment of TMJ disorders. This exclusion does not apply to residents of Minnesota. Treatment is finished within 31 days after individual termination of coverage. Completion of a prosthetic device, paying for them afterwards can still be painful. Fixing your child's chipped tooth or getting a crown replaced. About oral hygiene, plaque control, nutrition, and tobacco. Personal supplies issued by MetLife. Coverage terminates when your membership ceases, when your dental contributions, until you have reached your orthodontia lifetime benefits maximum. When visiting an out-of-network provider, employee plus child or children plus spouse is $148.38. Relationship with over years, even generations. So even if you see a non-participating dentist, 1 per 84 consecutive months, replacement of an existing temporary full denture, or by calling 1-844-222-9104 and using the MetLife is not a complete description of the plan. A full list of limitations can be found in your plan certificate. Register with My Benefits at www.metlife.com/mybenefits. Present an overview of your plan benefits. This document presents the majority of services within each category, but is premium for employee only is $34.86. For employee plus spouse is believed to be associated with good overall health. That's why we think it is so important to go beyond the plan cover liability law, for which the employer of the person receiving such devices is not required to pay for non-payment of premium and may terminate if participation requirements are not met or if the policyholder fails to perform